con la sed que tenemos. Good morning or good afternoon. Welcome everybody to the LHC Reach Out webinar. My name is Josie Gaitan and I work for Reach Out. It's a nonprofit organization in the Inland Empire. I would like to say that this webinar will be in English today and so sometimes in Spanish because Dr. Shapiro, I see you coming in. So we will be talking today. Dr. Shapiro's here today, and he's going to be bringing us up updates on COVID virus and explaining why we should be more careful and what things are not doing so good or so well. Why are we going backwards? We will also discuss the services of ICRC, Inland Caregiver Resource Center, what they offer, as well as the importance of self-care and both caregiving and professionals in attendance. We will also discuss some caregiver acts and how ICRC can help us with those who are caring for our family members. Today, Dr. Shapiro, Ilan Shapiro, Medical Director of Health and Wellness Education at the AltaMed Federal Health Clinic. Krystal Perez holds an Education Outreach Supervisor position in the Inland Caregiver Resource Center, who she has been working at here for 5 years. She graduated with a Bachelor in Health Science from California State University of San Bernardino in 2016 and is now currently attending the graduate program for the Healthcare Administration of the University of Laverne. As a caregiver herself, Krystal believes in educating and supporting systems and the two best tools to have for a caregiver journey. Today, you guys can give us the questions at the end of our speakers, or you can start putting them in the chat if you like. I would like to welcome Dr. Shapiro today, and hopefully he can bring us an update on everything that's happening. Thank you, Dr. Shapiro. Welcome.
It's always a pleasure. Thank you so much for the invitation. On reality, everybody's talking about waves, right? You know, like the first wave, if we finish it or not, but I can tell you for sure that the numbers in the world are going up. Europe is already seeing problems with hospitals, that a lot of people are starting to have a lot of sickness, using a lot of the intensive care unit that they were not used before, and for a couple of months. And the same thing is kind of trending here in the US. We're starting to see a higher number of people getting sick. Recently, with the MMR, it's a kind of a magazine that has all the data from a lot of diseases. It showcased that actually the Hispano community doubled the amount of people that were actually dying from COVID on the past months. Then we have a lot of things that we're seeing the red flags. Right now, we're seeing a lot of movement on the country. Halloween is coming. The elections are coming. We have a lot of important things to share right now. That's kind of the briefing on what is happening actually on the cases. With the kids at the beginning, that we saw that they were not being as affected as we thought, but right now we're seeing that, you know, at the beginning only 2% of the kids actually 2% of the cases were kids. Right now we're seeing 10% of the cases are kids. You will say, well, it's still a low number. You're right, but on reality, jumping from 2% to 10, it's a huge gain of a lot of people that are getting sick. Then we're worried about that. There's a couple of things that we think that are related. One is that kids are being exposed more. Reality, they're going to school in certain areas. Still, our communities are doing essential work. Then the family members are exposed. They can bring stuff to the community and to the family, and you know, that's another thing. And most importantly, you know, we need to be safe, especially right now. The Halloween is coming. I'm a big advocate of what actually the CDC, the American Academy of Pediatrics, is saying, that let's do a virtual Halloween costume party. Let's do things at home with the people that we already know instead of exposing other people to other places. Then that's extremely important, and that's a way that we can protect ourselves and do something that is positive, correct, and on the correct direction. Um, another thing for sure is that um, we need now to continue pushing forward with using our mask, social distancing, and washing our hands. We know that we are so tired of hearing those three things, and I hear you, I live it, and my kids, they are like, again, that. But it's extremely important that we continue doing this because we know that that's actually the thing that makes a huge difference. That's the thing that will open the gate to protection and other environments. It's extremely important to understand right now, moving on the treatment and prevention part of it, that there's 200 plus vaccines that are being created. Then whenever anybody tells you that, are you going to use the COVID vaccine? You can actually tell them like which of the 210 vaccines are in the world are creating, which one are you talking about? Because they are different, they have different flavors, colors, countries. Then it's very important that we need to wait and see what's actually happening, because the way that they create vaccines, it's not simple, but it's kind of this one. The first stage is making sure that you get healthy people, and you use the vaccine and you see if there's any side effects, or you measure the antibodies that they're creating on their bodies. The antibodies is there. It's actually what we want to have with a vaccine. That's the way that we can create like a shield against the COVID-19 when it attacks us. Then if that's the first phase, small, nice, clean, making sure that there's nothing crazy going on. The second one, you add more people and you still measure what's the perfect dose of the vaccine to have less side effects, better protection, and not do anything. Because you need to remember that vaccines are given to healthy people. That's the idea. It's when we get diabetes, high blood pressure, or anything of this, it's already out of our hands. You're already sick. It's kind of putting the band-aid on top of it. It's not curing yourself. With a vaccine, actually, we want to prevent and run away of against a problem. Then that's kind of one of the things that we have there. And the third phase is when we actually add the vaccine and we use it with people that have diabetes, obesity, high blood pressure, normal people, anything that a big chunk. And we have another group that we call the control group. That big group, they're giving something. Could be a different vaccine, it could be a different medication, just to measure and compare both groups. When you're participating in this type of groups, you do not know in which one you are. You just don't. You are jumping from one side to you're in one side and you don't know if they're giving it to you or not, but you're reporting your symptoms, your side effects, how you're feeling, and they measure if you get sick or not. Then that's where we are on that stage. We usually start with people that are on high risk, and we start going down. Right now, there's a couple of vaccine makers that will start, making sure and doing research with kids to see if they can actually get the shot or not. There's a lot of things that haven't changed right now. We know that kids right now have been being, they don't have that much complications as other groups. We know that, but still there's something called the multi-inflammatory syndrome. That's kind of something that we call Kawasaki. It's where after the COVID attacks you, your entire body starts creating a reaction a couple of weeks after you're cured, and you get like a weird rashes, fevers, you feel horrible, your heart can get inflamed, and other consequences due to COVID-19. Then that's something that kids are having more often than they used to. And on the realm of medications, we still have one antiviral there trying to make sure that if it works or not, it's showing promising. A promise, and the idea of that is to block the virus to enter our cells. The thing that this coronavirus does is it goes inside of our cells and uses our own cells as a machine making COVID producing thing. then at that time it produces a lot of viruses and goes to another cell, produces more and more and more and more. And with the antiviral part, we decrease the replication. In the other side, we have something called the plasma, the antibodies from other people. Then when you survive COVID-19, your body creates like a memory, and it creates like this special laser guided missiles. And those laser guided missiles are called antibodies. Sometimes we can actually take away from people that already survived and put it on people that are sick. We do not know yet if that's effective or not. We use it with other type of diseases, but not specifically with COVID-19. And we do not know if it helps or not. And the other side, we are actually creating, and probably you heard with President Trump getting artificial antibodies. We actually we're trying to figure out if we can create and give artificial antibodies. That way, if you're getting sick, they give you the shot of antibodies and you're done. That would be the best thing to actually have, or the complications that you could have are diminished. And that's kind of the full-fledged thing. And remember, this actually kind of a public service announcement. Elections are here. We all know that part. If you can vote right now, vote right now. That way you don't have to do the lines and anything else. Just leave it in a correct ballot box that it's official, and you're good to go. Or if you actually want to vote in person, I strongly recommend you to have a voting kit. The voting kit. You're like, what? A voting what? Yes. The voting kit is you grab some gloves. That will tell you the entire thing. Gloves, rubbing alcohol. After that, an extra mask, some type of snack, very important, and toilet paper. And you will go like Dr. Shapiro, but I'm not going camping. This is the deal. At least here in California, they are making sure that the lines are going to be trying to make it very efficient, to have like safe space between one place and the other. But if you're there and you need a restroom, at least with the gloves and the toilet paper, you know that you can actually go to any public restroom around you and you will be protected. If you're there for a couple of hours and you need, you still need calories, right? Then you get your barrita or whatever you want, and that's actually that's official Spanglish. And you get your little snack, and you have it there, and that way at least you're prepared for it. And enjoy that part. And the same thing right now that Halloween is coming. If you can stay home, stay at home. Remember that children's mask or adults mask that you're putting on, it's not protective against COVID. Then you still need to wear a mask. Make sure if you're going out, make sure that the whatever you're using, make sure that it's reflective, because that way you're going to be preventing accidents at night or with other cars. And ready for questions, comments, or otherwise.
Thank you, Dr. Shapiro. That was really amazing information, new information. I have a question that they just texted me. Let me get it here. So why are we going backwards, Dr. Shapiro, instead of forward?
Oh, that's a beautiful question. We know why. We never decided as a country and as a continent and as a world what was the best way to close everything. We just didn't. And even in the US, and I'm going to go from the world to the US, right now that we're seeing that each state actually behaved as its own country, and any way that they could do whatever they want on that state, but there's no borders between states. And after that, you had people that public health is very specific. There's 3 things that has worked from many years back until now, and it's the social distancing, the mask, and the gloves. And I'm going to give you a quick, interesting fact that in the past, the flu pandemic, the Spanish flu pandemic in 1918, killed more than 50 million people. And they were having the same debates that we are having right now. If masks work, if having like some type of social distancing, they had this, that was 100 years ago, and we thought that we were advancing. Then a lot of the debates that we were having, and it was proven that the places that actually were using masks and everything else had less amounts of deaths and perishaments around them. Then we know right now that that works in many fields. Then opening in summer, everybody started to go out. We had like Mother's Day, Father's Day. We have Labor Day. We have a lot of things that people were like close, not because if it's a family member, the virus doesn't care if it's a family member or not, and if you actually love them or not. If they have it and they are asymptomatic, they can still give it to you. Then a lot of people start like spreading around this type of problems with the disease, and that was one. And the other one was that we started opening the economy, and a lot of movement. Us as essential workers, we need to move from point A to B to work. And sometimes, or most of the times, it's actually public transportation, and you're more exposed. Then all of this actually is creating that movement that we're not fully stopping the virus. We could, but we haven't done that part. And I was having a conversation yesterday with Leon Krause, that it's a journalist from Univision 34. We were talking about the possibilities of like shutting down once and be over with it. And that was a conversation at the beginning. A real shutdown where we buckle up and we do that part, but I don't think that that will be that's the public health answer. But right now, with the things that we have, that kids are going back to school, we have certain kindergartens open, and stuff like that. There still continues the reality that us as humans are the only thing that can create that virus. Then it needs to jump from one person to another, and if we are out there, the virus will still be alive. Then that's kind of where we are, and we need to remember that, as I said, we need to reflect how are we going to change the next following days, because we have Halloween, and for a lot of Hispanos, Dia de los Muertos is very important. Then how are we going to make a different celebration with our family members that have departed in a positive way, that we give them their space, their respect, without harming us on this side. Then that's something that it's up to each family to make a difference there.
Thank you, Dr. Shapiro. Do you have any questions, Jesus? I have one more question. I think it's it's been coming really close to our family and knowing more people that are getting sick of this. Why do some people test positive and don't feel sick, and some people test negative and feel very sick, or feel all the symptoms?
It's a great question. We still do not know. We haven't found a marker or something that will go like, oh, you have blah, 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 then you blah. We just don't know. Then we do not know. It's the same thing as influenza and other viruses that we have, or infections that we have, that there's certain people that are more immune to it, meaning that, or not, I would not use the word immune. The bodies can actually kill and neutralize the virus faster. And we're not yet there.
So is it more dangerous if you get the virus twice? Or
it's a beautiful question. I'm going to walk you through different scenarios. The first time you get it, you're fighting it, you're good. And we had the question if you can actually get it the second round, and we didn't know. In theory, this type of viruses, and we saw it with MERS and SARS, are like cousins from COVID-19 that happened in China, and another one in Middle East. When you got it, you were practically very covered against it. Your body will remember, and it will be very hard for you to get it again. With COVID-19, we didn't know. And right now we're starting to see a couple of different episodes and moments where people are getting sick again after a couple of months and again a couple of months. Um, and it's kind of so there are so little amount of people that have that you can actually prove that it was two different infections in two different places and it was 100% real, that it's not worth talking about what happened to them. But in general, there were two outcomes. One, that they got a very mild kind of runny nose thing, and the other, in a couple of other ones, ended up in the hospital and had a worse reaction than the first round. Then we still do not know.
Okay. Thank you, Dr. Shapiro.
You're welcome.
Muchas gracias. Very good information. I don't know if Jesus has any more questions.
I don't have any.
No? Okay. I have one more for you, Dr. Shapiro. I know we had last week we had a doctor talking about the flu shots, but I still have a lot of phone calls calling me and saying that they don't want to do flu shots because they're scared.
Yeah, nobody likes the needle. That's a given fact. Nobody likes the needle. Like, I've never met someone that goes like, yes, give me the needle. Nobody. But it's very important to understand a couple of things. That this year is a special year. And the moment that we combine two infections, and I'm going to give you the example. Imagine that I tell you that I have an infection, that I can actually give you a medication. And not only that, I can actually prevent you to go to the hospital if you're exposed. And if I give you the same questions and I tell you right now for COVID-19, imagine that I have a medication that will help you defend yourself against COVID-19, and the other one that will prevent you to even getting sick. Would you take it? Most probably yes, because that's what we're trying to do right now to reopen the economy and putting everything together right now. We have that for influenza. And the important thing about influenza is to remember that influenza, it's not just a simple cold. It's not. It's not just, ay, me dio un poquito de fiebre. It's not just me dio un poquito de fiebre. I had a little bit of fever. It's not. It's a virus that, hits millions of people every year, puts hundreds of thousands on the hospital, and kills hundreds. Like last year, I think that I don't want to give you, I think that it was more than 60,000. Then it's a huge number of people that could be saved with the vaccine. Then why not get it? And I get it. And by the way, I think that us as doctors are doing a very horrible job. Why? Because we call it the flu shot. Then is it the runny nose flu thing or the stomach flu that I'm getting? Why I get this shot, tomorrow I get a cold? To clarify, that's why I'm using influenza virus vaccine, because the vaccine is actually against one type of virus that is called influenza, and that virus is the one that will throw you to the hospital. We still have a list of more than 30 viruses that have colds. They can give you colds, fever, the runny nose, I feel bad, 2 days you're gone and you go back to work. But influenza will throw you like one week out of work and can have complications with pneumonia, infections, and other stuff. Then it's a different thing. Then when you get the influenza virus vaccine, you're being protected, not 100%. There's no 100% in life. It will protect you against complications and ending up on the hospital. Even, and that's very important. And there's side effects, because a lot of people go like, oh my God, what are the side effects? The side effects are redness on the arm, pain on the arm, and after that, that's mainly it. And it can be covered by Tylenol or by Motrin or whatever you want to prevent, having fevers and other maladies and stuff like that. Then you're already having all these things around you that are making a huge difference to protect yourself against the worst of the worst. Then imagine that we have influenza. You get influenza. When you get influenza, your immune system resets. Your entire soldiers that protect your life will go down. The moment it goes down, you have an issue, because COVID or other infections can go in and create headaches to you and your family. Then that's where the problem comes. Then if you have the flu shot, you reduce the possibility of getting a major infection in a major pandemic to help you survive. Then I get it. You know, if you don't want to, you do it for yourself. Think about the people around you. This vaccine can be given from kids that are like 6 months and older. There's very little contraindications to actually getting it. Then, you know, if you're not doing it to yourself, do it for those kids that cannot get a vaccine, those people that have cancer and they cannot, you know, get a shot, or other people that have autoimmune diseases that cannot get the vaccine. Then it's extremely important that we participate on this one. And the other thing is that if we imagine that nobody gets the influenza virus vaccine and everybody gets sick, or a huge higher number than regular with the influenza virus vaccine, what's going to happen to our hospitals? This is going to, I'm going to tell you the story. We're going to have pandemic going up with COVID-19. We have more influenza patients, than, you know, the hospitals will be tied. By the way, but if you have diabetes or a heart attack or stroke or cancer or other stuff that you didn't plan for, you know, that is, you know, they're not going to wait and go like, oh, we're a team, we're going to leave influenza and COVID, do whatever they want to do in the hospital. No, we will have issues. And that's why it's so important that we do not stress the healthcare system the way that we could potentially do. And the beautiful part is that this is actually not set in stone. This is something that we as a society, as a community, as a everything, can make a difference.
Thank you very much, Dr. Shapiro. And you're welcome to talk Spanish. It was just, we were announcing we have translation, but I know that we love to talk Spanish and English. But thank you very much for this great information. And I really, really thank you for taking your time. I know it's hard for you to get out of your busy day, but we want to thank you for all the information you bring us. And would you like to stay at the end, or you have to leave?
I'm going to stay as much as I can here. I will be eardropping on the background, if it's okay with you.
It's okay. Thank you very much. And thank you for staying with us and giving us all that great information. Now I will give the floor to Krystal Perez, and she will give us more information regarding all the information she brings to us. Krystal, the floor is yours.
Hi, thank you. All right, so my name's Krystal. I'm going to be doing a presentation today, just some information about Inland Caregiver Resource Center. So as you saw the picture before, that was just a picture of me. So our agency is called Inland Caregiver Resource Center. Our mission is helping families cope with and manage the challenges of caregiving. Okay. On the next slide, it shows us how we started. We're actually one of 11 caregiver resource centers in the state of California. So every county has their own. We actually service San Bernardino, Inyo, Mono, and Riverside County. But LA County has their own resource center, you know, Santa Barbara, San Diego. Some of the centers have multiple counties like us, but every county has a resource center. We were actually established in 1984, but then we launched in 1985. Okay, on the next slide. So, you know, who do we service? What is it that we do? Our clients, so our service, the people that we service are family caregivers. This is a family member or a friend, so we call them informal caregivers, that are providing care for a loved one that has a brain impairment. So brain impairment can be anything from dementia, a traumatic brain injury. So if you had a car accident and your brain is damaged, one of the symptoms that we do have to ask for, it doesn't have to be diagnosed, but you have to have some sort of dementia symptoms, so like memory loss. And they do have to, the symptoms had to occur after the age of 18, or if you're a family member caring for someone over the age of 60. So for example, for myself, I care for, my grandma's 96. She's maybe showing some symptoms of dementia. I mean, she forgets where she leaves things. She has so many, we're Mexican, so she has so many grandchildren. She forgets my name. She forgets my sister's name. But she actually has a heart condition at 96. So her primary diagnosis is, you know, heart disease. and she doesn't have dementia, but we care for her. So we're, caring for grandma. We also have services for any older adult over the age of 60, regardless if they have dementia, regardless if they have a caregiver. They just need some assistance in the home. And then again, at the bottom, it says they must live in either San Bernardino, Riverside, Inyo, or Mono County. So we service all 4 counties.
Okay.
Now, what is it that we do with our family caregivers? So again, our family caregivers are our clients. They are, we want to service them. It can be anyone from mom taking care of the daughter, or it can be daughter taking care of mom. It can be that you're taking care of your neighbor. I mean, maybe I'm taking care of my 70-year-old neighbor, and I just, I go over there every day. I give them food or something. So as a caregiver, I need help also. I know that the doctor was talking right now, and it's right now more than ever, we need to take care of ourselves and do self-care and mental health. So really that's our focus as an agency. We give information and referrals. So if you call me, Krystal, I need help with my bills. Maybe that's not something we do, but we can refer you to an agency that might help you with your bills. Our core service, and this is actually just a list. So on the next slide, it has our 800 number. So our 800 number, anytime I think of ourselves as a resource center. So even if we don't do that service or we don't have that, give us a call and we can see what we can help you with. Okay, and we do appropriate referrals to other agencies. Our core service on the next slide shows what's called a family consultation. This is an assessment of the caregiving situation. So I don't know anyone listening, if you are a caregiver, if you know of a caregiver, but we want to assess how you're doing. If you're going into depression, or maybe you're just not feeling yourself, you feel too burdened. Right now we saw a huge increase in our calls because these caregivers used to be able to take, I used to be able to take mom to the senior center and then I come and pick her up in a couple hours. Now it's all day, every day, especially if they have dementia. It's hard. It's hard being a caregiver, especially 24/7. You don't have Christmas off. You don't have Thanksgiving off. You don't clock in from 8 to 5. It's all day. They have sundowners and then they're up all night. So we assist the caregiver. We do problem solvings with them. We develop a care plan. And most importantly, I think we're just an emotional support system. I mean, we get calls sometimes that they just want to talk. They just want to say, Krystal, I'm going through this and mom did this. And I'm not a counselor, but we do have counseling on staff. And so that's one of the next services. And the next slide is one of our programs that's called Respite Program or Respite Care. Respite is a break from caregiving. So we actually contract with home care agencies, and we actually pay for a professional caregiver to come into your home, and then they can give you that rest. It's a little different now with COVID because no one really wants anyone to come into their home, which is fine. We do still have it available if that's something that the caregiver needs. And so respite, again, we just pay for someone, they come into the home and then they can do either some light house cleaning, they can help with bathing, maybe they just want companionship for their loved one. Then it just depends on what type of grant. So it says, it's in home. Usually we have homemaker, which is like house cleaning. Sometimes you just need a break from the house cleaning, just wash my dishes, clean my floor, make my bed, do my laundry. That's also considered a respite. Or personal care, which is taking care of the actual client. We do have adult daycare and 24-hour placement. Those are on hold at the moment because of COVID. The daycares and the 24-hour placements, they're actually not allowing any new clients to come in. But we do still have respite, it's just limited. Like I said, I'm not a counselor, but I believe we have 4 counselors on staff. And it is short term. So we provide 10 one-hour sessions with a counselor. It used to be in person. At the moment, we're doing everything virtually. So we can do it over the phone or over Zoom. And it's just there for the caregiver. Like I said, I'm Hispanic. I grew up my mom and my dad, so it was, you don't talk to a counselor. Everyone has problems, deal with it. Don't air your dirty laundry. now that I'm in a social service agency, I think everyone needs counseling. And it's not that we're making, how do I say this? Like, it's not that I'm complaining about what's happening. Sometimes it's just, I wanna, see, I can think of the word, I know right now you were talking about English and Spanish, is desahogarme. Me quiero desahogar, like I just wanna talk about it, you know, and that's not that I'm complaining, it's just sometimes we wanna get validated that what we're going through is real. And so it can be individual or group, but most of the time it's most commonly used for individual sessions. We do have a list of support groups. On the next slide, it has the whole list. I believe there's a couple missing from this list also. I need to update it. So we used to have them by region or by city because we used to have them in person. So Upland, Loma Linda, Victorville. Now all our support groups are virtual, but they're still at the same day and same time. So it's still, you know, Upland is still the last Thursday from 2:30 to 4:30. So this just means that we have more options. If a Monday doesn't work, maybe you can do, you know, a Tuesday or a Wednesday. Like I said, there's a couple on here that we haven't added. We have an evening one now from 6 to 7:30. We're actually working on a men's support group, so men caregivers. Although most of our caregivers are women, there's a lot of men taking care of either their wives or their own mom or their, you know, partners. It doesn't have to be an actual marriage. So this is just a list of our support groups. Again, you know, anyone is welcome if you're a family caregiver. The next slide shows we do educational classes. Now this is what I'm mostly doing with our department. I think education is the best form of, you know, just preparing you. So on the next slide, it shows the different types of educational classes that we have. There's one that's called the Controlling Frustrations. We have one to place or not to place. Like I said, we have to be very culturally sensitive. As a Hispanic, you don't, you know, grandma stays with us. You don't put her in a home, you don't put her in, you know, something else. But that doesn't mean we don't want to give you the information. You know, if you want to know how much does it even cost? I don't know if anyone listening knows the average cost of a, you know, a long-term or memory care facility, but on average, it's about $5,000 to $7,000 a month. So that's just we want to provide you the information so that you can make the right choices. And then we also have just little every one-day classes. So we have our core classes that meet weekly, and we have one-day classes that we call toolboxes. And those meet just randomly. We have a calendar on our website, and if you see one that's called, you know, diabetes, caregiving and diabetes, why are caregivers have a higher rate of diabetes, or heart health, how can we take care of our hearts? So we have different topics, different subjects that we talk about. Our most popular ones are like self-care or communication, you know, learning about dementia. What is dementia? A lot of people don't know that Alzheimer's is a type of dementia. Parkinson's is a type of dementia. You know, dementia is an umbrella that it's kind of like saying I have cancer. Well, you want to know what type of cancer you have. So if the doctor just tells you you have dementia, it's really important to know what type of dementia, because then we can go and say, well, this medication will help and this medication won't. If you can, yeah. So this slide actually talks about our conferences and our retreats. Unfortunately, because of COVID, it is on hold. We're not doing our online, or we're not doing our in-person conferences. We're doing online webinars, but hopefully soon we'll be able to do our conferences again and our retreats. These are just one-day events for our family caregivers. We usually have, you can see one of the pictures if you can see it. We usually have haircuts, hairstylists, we have manicures, back massages. Sometimes we have like blood pressure screenings or glucose screenings. We do painting, we do music therapy. We have Zumba, we have a DJ. It's a party, but it's educational. We do have like a doctor or a presenter come in and talk about caregiving and self-care or dementia. So I think our conferences are just it's like a mini party, just a little bit. And that's to celebrate the caregiver, just to give them some time off, and then again, to celebrate them. Our next slide talks about, we have a program that's the community-based occupational therapy program. We do this in collaboration with Loma Linda University, and that's 8 to 10 in-home sessions of OT for the caregiver and for the person that they're caring for that has to have the dementia symptoms. Unfortunately, our funding, we get funding from Riverside County and the state, and the funding for this program only comes from San Bernardino. So for this one, you do have to live in San Bernardino County. And so we do have the OT program, which is great. And I really wish that more people were able to use the OT program, and hopefully in the years coming, we get funding from Riverside County. The next slide talks about what we call supplemental services. This one can be for caregivers or for just anyone who's over the age of 60. So supplemental services are services such as the minor home repairs or assisted devices. And again, this is only available in San Bernardino County because unfortunately we don't get funding from Riverside County. Although we know we can refer you to another agency that might help. But this is anywhere between, putting grab bars in the restroom or putting a shower chair, or I don't know, sometimes we've been able to do, I had a client one time who had Parkinson's, and we just bought them new utensils and new bowls, new cups and plates that were weighted, and they're specifically for patients with Parkinson's. So anything that we can do to go into your home or buy something, or even just, if we can get you like I said, like grab bars in the restroom, if we can go in and make your home a little bit safer, then we'll do that. So that's a supplemental service we're able to provide. And the next one, a little bit more about our senior support services. So anyone over the age of 60 can get some services from us. If you can go to the next slide. We have what's called, I already explained it a little bit about with caregiving, but we also have it with our seniors. You don't have to be in a caregiving situation. Personal care, sometimes, once we're over the age of 60, we just need someone to, come and help us out. And the homemaker, we just need someone to come and, help us clean our home, or help us, change our laundry or change our bed. We do have chore. It says SB because it's San Bernardino County. Chore is any outside work. So if you need your, maybe a tree is a little bit too big, we can cut it down. Or if you need some help with, it's a little bit more that like deep cleaning inside the house or outside. We do have the minor home modification. So like I said before, if you need grab bars, or if you need, maybe your ceiling fan isn't working, so we can go in and fix it. Or maybe the light bulb isn't working, then we can try to fix it. We are limited, so we can't do everything. Like if it's with electricity or like the toilet that has water or plumbing, we aren't able to do it. But if it's minor, just some things that need help, we can do it. The last program that you see on there, it's called Pearls. This one is only for Riverside County. Pearls is an acronym. It's Program to Encourage Active and Rewarding Lives for Seniors. And it's an evidence-based program for seniors over the age of 60 that are having some symptoms of depression. This is a really hard topic because most seniors, or even young people, depression is a very taboo. You don't want to really say, oh, I'm depressed. But sometimes we see that we're just not feeling ourselves, or life just takes a toll, especially right now. Self-care and personal care is very important. So the Pearls program helps. It's a one-on-one with the client, again, a senior over the age of 60. And we do a one-on-one, and we try, it's 8 to 10, I believe it's 8 to 10 sessions with the client to try to work on problems. It's problem-solving techniques. There's a correlation between a lot of problems and then the symptoms of depression, and then also incorporating physical and pleasurable activities that we can do. We call our Pearls counselors, we call them Pearls counselors, but it's not like talk therapy. It's very different, but it is a great program for anyone living in Riverside County. And if you feel like you're just not yourself, you're just a little down, the Pearls program is great. Okay, the last slide just has our information. If you want any more information, or if you want more, if you want the services, just let us know. I don't think I have it in the slide, but I did, all our services are free. We're a nonprofit. We don't charge for our services. It doesn't matter if you have documentation. It doesn't matter your income. We have Spanish and English speakers on staff. And if you need another language, we're more than happy to get, an interpreter. But we do have our 800 number, the 909 number. It's the same. It'll still come to our office, and then our email address and our website. We do have a Facebook and Instagram. So if you go to our website, usually we can redirect you to our social media as well. Okay. Does anyone have any questions? I don't know if I went through that a little too fast. I do want to just say we do have a webinar coming up on November 19th. Like I said at the beginning of this presentation, we are in collaboration with 11 resource centers on all the state. So on November 19th, November is actually Family Caregiver Appreciation Month. So we usually go big in November, but unfortunately because of COVID, we're doing a webinar on the 19th from 4 to 6. And if you're interested, just give, you can send us an email or give our office a phone call. We do have I believe it's actually on one of the handouts here. The handout is our brochure if you want more information, where we're located. We're actually in the city of Colton, but we service, again, all of the Inland Empire. I mean, if you live in Indio, if you live in Temecula, all the way up to Barstow, we service all of San Bernardino, Riverside, Inyo, and Mono.
Thank you. I didn't notice that I was mute, but thank you, Krystal. This is very good information. We have your brochure on the handouts, and you guys can look at it. But we have it with you. If you guys need more information for Krystal, or about Krystal, what they do and what they offer, just go ahead and give us a call, or give me send me an email, and I will be happy to help you and get in contact with her. This was very good information. I don't know if we have any questions in the questionnaire, Jesus, but I have a couple of questions that came to me. So if there's a family that's taking care of somebody in their house, a family member that's taking care, like the daughter's taking care of the mom and the father, can they get paid for that? Or is there a program that can get paid in Riverside County?
Yeah, so both Riverside and San Bernardino County have programs. We don't do it for our agency, but the actual county does. So it's IHSS, it's in-home support services. They have their own application. We usually direct them to the county. It's Office on Aging or the Department of Aging and Adult Services. And so they may qualify, because that's more than a full-time job, taking care of both parents. Most of our caregivers are still working. I mean, they're 50, 60, even some 70-year-olds, they're still working, either full-time or part-time. And so you can get reimbursed, and the county actually has that program. We don't do a reimbursement, and that's why we just do a short-term respite. So our short-term is just when you're, we don't want you to burn out. We don't want you to say, I'm done, I quit. We know that you love your mom, you love your partner, or some people are taking care of just their family friend. Most of the time we do it because we love the person, but sometimes you just need a break. It's a little different to compare it, but it's just like your children. You love your children, but you just need a break. And that's when we try to step in as a resource and give you that break, or at least give you the resources to know how to handle it.
So it's very good information, and very information that a lot of people don't know about it. But it helps a lot. It does help, that just to give you that little break in between the day, or once a week, that you can go out and do something else. It helps. It helps a lot.
Right now,
go ahead.
Oh, right now, I mean, my parents are baby boomers. Like I said, my grandma's 96, and so I see myself. I mean, I'm only 28, and so I see my parents aging, and I see my mom and my grandma aging, And although I'm not with them 24/7, I still care for them. I'm still, do you have your medications? Did you eat today? Just yesterday, my mom called me and said, I need this medication, I need this appointment. And, she has the language barrier because she only speaks Spanish. So I am her caregiver, and even though I don't live with her, I'm still her caregiver. Now, when you live with them and you're 24 hours and they have the advanced dementia, it's even more harder. It's even harder.
Yes, it is. I took care of my mom. She had Alzheimer's, and I took care of my mom for 10 years. And the four last years were the hardest because she was bed rest at the time.
Yeah.
But it was hard. But my break was I had a part-time job, and I used to work at the school, and that was my getaway every day. So
Yeah.
it helped. Even though I went to work, but it helped. But and I learned something new with you. I didn't know dementia or Alzheimer's was part of the dementia. It was like how you explain it, the cancer, and then you don't want to know what kind of cancer you have. That's new. So I learned a lot today.
Yeah. There's actually more than 100 different types of dementia. There's Lewy bodies, there's Parkinson's, there's frontal lobe. It just depends on what part of the brain is damaged. Alzheimer's is the most well known, but it's a type of dementia.
So we would call you. They would call you to get like information about somebody coming in and helping them clean the house if they're living on their own.
Yeah, we do an intake. So it takes us about 2 days to, once you call, we place you on a call list. I hate to call it a wait list, but it kind of is. It takes us about 2 days to call back. And then once we complete the intake, it's just basic demographic information. Because we get our funding, we're nonprofit, we have to provide that information to the counties. And once we have that, it usually can take another day or two, and we call it grants. So we write up a grant and we say, okay, you're gonna get 12 hours, or you're gonna get 16 hours, and someone's gonna come to your home. Or if you say, well, I want counseling, then we say, okay, we'll give you a counseling grant, and then we set it up. What's the best day and time and hour that you want to do your counseling sessions?
So
And
go ahead.
and then they get assigned a social worker on our staff. So a social worker will be assigned to your case.
So like the social worker for, I'm not sorry, the lessons for depression, is that just for the caregiver or for both?
It depends. So the pros one with depression, they can have dementia, but since it's client driven, it's very like problem solving. So the client has to be interactive and be willing to partake in the problem solving. So they can have dementia, but they just have to be in the early stages because they have to comprehend what's happening. So that one can be for both the caregiver or your loved one. It can be for anybody.
Okay. But you have two different kinds, right? So they can have sessions for that?
Yeah, they would do their sessions separately.
Okay. So I don't think we have any more questions, but it was very, very good information. I really appreciate all the information. I learned a lot, and I thought I knew a lot, but I learned a lot about your program. And I want to thank you for taking the time and coming and telling us all the resources that you have. And we will have your phone number, and we will put it in our Facebook. If they need more information, they can call us, and we'll refer them to you.
Josie?
And so if we refer somebody to you that lives in Pomona, you have other resources over there, right? Or
yeah. So Pomona, since it's LA County, they would go to it's called LA CRC, and they're based out of UCLA, and they service all of the LA County area.
Okay.
I have some questions over here, Josie.
Okay, go ahead.
So one asked, do you work with caregivers for people with cancer?
We don't. So the way that they would qualify if they have cancer, because it's not a dementia symptom, unless like if cancer is their primary diagnosis, and then sometimes we have it where they're secondary, they start showing some symptoms, then we can do it. Or if they're just over the age of 60. So if they're caring for anyone over the age of 60, it doesn't matter the diagnosis. But if they're under the age of 60, so like 50, 59, or anywhere younger, they do have to have that memory loss symptom. So just, something is causing a brain like memory loss. If it's just cancer and they're 40, then we wouldn't be able to.
Can you
No.
refer us to somebody else that does that kind of help?
We can. Yeah, we can. From the top of my head, I can't think of anything. I remember there's one, it's actually a cancer resource center in Temecula. I can't think of the name though, but that's what, if they give us a call and we can try to see what other resources are available. Because there's a lot out there. We just don't know it all.
Thank you.
Yeah.
You have another question, Jesus?
Yeah, another one came in. Does your center have respite assistance for adults taking care of their grandkids?
We don't. We actually are working with Riverside County, and they have a program that's called Grandparents Raising Grandchildren, and they have a respite program. So we just collaborate with them. So if you live in Riverside County, if not, I believe San Bernardino County also has it. We just don't have like a relationship like we do with Riverside, but we can definitely figure out what other respite programs are out there. But there is a program. It's Grandparents Raising Grandchildren. With the counties. Both counties have it.
Did you say grandparents, crazy grandparents or something? What did you say the name was?
Grandparents Raising Grandchildren.
Oh, okay.
Mm-hmm.
I heard something crazy. It's like another question, Jesus?
No, that was it.
Okay. Well, I just want to say thank you again, Krystal. Very good information. I've learned a lot again, and I want to thank you for taking your time and coming and sharing all this information with us. And if anybody needs information and you didn't get her number, Krystal's number, or the 800 number, you can always call us or email me, and I will give it to you as soon as we have. And I just want to say it was really nice to talk to you and to have you here introducing your programs to us. Thank you, Krystal.
Thank you. And if I can have just leave one little note. I know that in my bio that I sent you, I said it's also for professionals. I mean, we focus on caregivers, but our main focus for our agency is self-care. And just like our caregivers need self-care, if there's professionals listening, we also need self-care, from work, especially right now working from home. So if anyone needs any resources or any just information, please feel free to reach out. You have my email, but I don't think I put it on the PowerPoint, but our email that's on the PowerPoint actually goes to our administrator, and then she can redirect it to me.
And we could always give them your email or put it in our. I think
of course.
Was it in your brochure?
My personal email for my work is not. The general email is info@inlandcaregivers.org. Mine is just my first initial, so K Perez @inlandcaregivers.org.
Okay. So we could always share it with, if anybody missed it, you could always share it. But I do want to thank you again, and you guys have a wonderful, wonderful weekend, and stay safe out there. And thank you for all the work you guys do out there for all the caregivers and all the clients that you have. So I just wanted to say thank you again, and I hope that you guys all have a great evening. And thank you for coming and sharing all the information with us, Krystal.
Thank you for hosting it. Thank you.
So we will see you all next week. Thank you to our presenters and all our speakers. I don't know if Dr. Shapiro left already, but I wanted to say thank you again for him coming and taking time out of his busy time. I know it had been hard for him to show up with us because he's been very busy, but I want to thank him for coming and giving us the updates, and we'll hope to see him soon with better information. And we'll see you next week with another good speaker and more questions. If you guys are wanting to come and have different speakers, certain issue that you guys want to go and have more information regarding, just give me a call or send me an email, and I will be happy to find somebody to come and talk about the issue you guys are wanting to hear about. Thank you very much, and you guys have a very good evening and a very great weekend. We'll see you next week, Thursday. Bye-bye.